Dear health education leaders,
as a public health student,
as a pharmacy student,
as a dietetic student,
as a medical student,
as a nursing student,
as an epidemiologist in training,
I feel ill-equipped to prevent the health harms of climate change my patients and communities face.
In the recent months, climate change has fueled one of the most violent tropical storms ever faced by areas of my country that are usually spared.
Here in Richmond, Virginia, heat waves affect communities of color and low-income neighborhoods disproportionately, and yet, I'm not taught what that means for their health.
The evidence is clear for more frequent and severe wildfires, to floods and droughts, poor air quality and increased spread of infectious diseases. Climate change is the greatest threat to health that we face in the 21st century.
The COVID-19 pandemic has already highlighted the unprecedented strain that large-scale health crises place on health systems and healthcare workers.
And low-income communities of color, indigenous communities, will suffer the worst consequences.
A whole generation of nurses and nurse practitioners.
A whole generation of doctors.
A whole generation of pharmacists will have to care for those who suffer from the health harms of climate change.
Yet there's little formal acknowledgement of the coming climate catastrophe in our education.
But the solutions we need already exist.
The Global Consortium on Climate and Health Education has resources and frameworks for educating all health professionals.
Our health education encourages us to think deeply and collaboratively about the health problems we face.
And climate change is no different.
Educating us on the impacts of climate on organ systems, structural determinants of health, health policy, and health systems science is an opportunity
to prepare us to face the challenges of a lifetime.
But we need your help to make it a reality.
We need your leadership to push for sweeping educational reform,
required to prepare a generation of healthcare providers to address the consequences of climate change.
If schools integrate the impacts of climate change on health into existing curricula,
then as an epidemiologist, I will be able to better understand the interaction of climate change with health risks and health outcomes.
As a physician, I will be able to talk with my patients about the impact climate change is having on them.
As a nurse, I will be able to provide heat action plan for my patients in a heat wave.
We, as health professional students, will spend the entirety of our careers working with patients and in communities increasingly impacted by climate change and environmental degradation.
With the proper training,
we can fulfill our duties as health professionals,
secure the health of our patients,
and achieve a more just society.